say
from 2 Political Science 2.
Do you smoke?
Dati, I used to smoke.
So, do you smoke po?
Dati.
Hello, do you smoke?
Hello. Hello po. Do you smoke po? Do you smoke po? Yes. Do you smoke po?
Yes.
Are you smoking?
No, and
He's uncontrolled.
Mouth! Pharynx. Aray.
Natinig ka ba sa larynx?
Di
Ano yung trachea? Di ba sports yun? Trachea and field.
Bronchi. Alam mo yung bronchi? Yung parang puno na gulay. Yung beef bronchi.
Bronchioles. Di ba gulay yun? Bronchioli flower. Who's there? Lungs, woo!
Na na na. Na na. Let me lungs you.
Who's there? Alveoli, woo!
Can't live. I'll be living without you.
Alright.
Hey, how was your day?
Oh, it was great. I enjoyed my class. How about yours?
Go.
I did not even enjoy it because it's so many assignments and requirements. It's so exhausting.
Oh, that's too bad.
But I'm okay now. I actually find a new way to reduce tiredness.
Oh, that's good. Shall we go now?
Let's go.
Here we go.
Knock, knock.
Who's there?
Diaphragm.
Diaphragm, woo!
Diaphragm. Diaphragm. Diaphragm.
Saan yung diaphragm dyan?
Ito. Diaphragm.
Alright.
This day is so tiring.
I know, right? There are so many requirements to pass.
You know, I read this article online
What is it about?
that smoking can help you get through a tiring day.
Really?
Yes, I also read the comments and they said it's effective.
But isn't it bad?
It's not.
I don't know about that. I don't like it to try.
What is easy? I'll go in outfit and I'll buy a Mac.
Okay, bro.
Bro, why?
You're so big, bro.
Oh, sorry.
The human body needs oxygen to sustain life. So the human respiratory system are composed by different organs responsible for taking in oxygen and expelling carbon dioxide. The main organ of respiratory system is lungs, which carry out these exchanged gases as we breathe.
In order to stay alive, the body has to breathe air. We breathe in oxygen and we breathe out carbon dioxide. This process is known as respiration. Breathing happens automatically. Every day, the body breathes about 20,000 times. By the time we reach 70 years old, that's about 600 million breaths. All of this breathing occurs because of the respiratory system, which includes the nose, throat, voice box, windpipe, and lungs. At the top of the respiratory system, the nostrils bring air into the nose, where it's filtered, warmed, and moistened. Tiny hairs called cilia protect the nasal passageways and other parts of the respiratory tract and filter out dust and other particles that enter the nose through the breathed air. Air can also be breathed in through the mouth. The two airways of the nose and mouth meet up at the pharynx, which is located at the back of the throat. The pharynx carries both food and air and is used for digestion and respiration. One path is for food. This is called the esophagus, which leads on to the stomach. The other side is for air. It's called the trachea. A small flap of tissue, called the epiglottis, covers the air-only passage when we swallow. This stops food and liquid from going into the lungs. The larynx, or voice box, is located at the top of the trachea, the air-only pipe. This is where our vocal cords are. The trachea, or windpipe, which is a 2 to 3 centimetre tube, then extends downwards from the bottom of the larynx for about 12 centimetres. The walls of the windpipe are made strong by stiff rings of cartilage that keep it open. The trachea is also lined with tiny hairs. They sweep foreign particles and fluids out of the airway, keeping them from entering the lungs. The windpipe divides into 2 branches, and each one of these enters one of the 2 lungs of the body. Each branch resembles the limbs of a tree, dividing into smaller, finer branches called bronchioles. The bronchioles end in tiny air sacs called alveoli, which look a bit like grapes. These structures enable fresh air to get to the air sacs, which are surrounded by tiny blood vessels, or capillaries. The oxygen passes through these air sacs and travels through the capillary walls into the bloodstream. At the same time, carbon dioxide transfers from the bloodstream into the air sacs, where it gets breathed out of the body. When we exercise, the body needs more oxygen to feed the muscles as they work harder. The body responds by breathing more quickly and deeply. As the cells of the muscles use up more oxygen, the lungs have to work harder to keep up the supply. The respiratory system then speeds up to supply the body with much needed oxygen, and also to get rid of the carbon dioxide waste in the system. Over time, exercising also helps our chest cavity to get bigger, which enables the body to increase the amount of air it takes in. More capillaries form around the air sacs, so the body gets better at swapping oxygen and carbon dioxide gases. We can see how the body's respiratory system helps the body to move about, and is influenced by regular and ongoing physical activity as well.
Conditions of the respiratory system falls into 2 places. First is the viruses, which are the influenza, bacterial, and pneumonia. Second are the chronic diseases, which are asthma.
Are you anaerobic respiration?
Why?
Because you take my breath away. Why? Lung cancer by the uncontrolled growth of abnormal cells.
Go.
It is often associated with smoking, but the disease can also affect non-smokers as well.
So, charot, nakalimutan ko eh.
Wait lang.
It's a chronic inflammation of the lungs, causing coughing, wheezing, shortness of breath, and chest tightening. Preventions for tuberculosis. First is to stay at home to prevent inhaling smoke. Second is to cover your mouth when coughing. Second is to ventilate the room for fresher air. And fourth is to wear a mask when going outside. But there's no way to prevent asthma. You can design a step-by-step plan for living with your condition and prevent asthma attacks. Follow your asthma action plan. Get vaccinated for influenza and pneumonia. Identify and avoid asthma triggers. Monitor your breathing. Take your medication as prescribed. Pay attention to increasing quick relief inhaler use.
Act number 9211, an act regulating the use, distribution, sale, and advertisement of tobacco products.
This act is also known as the Tobacco Regulation of 2003.
It is the policy of the state to protect the populace from hazardous products and promote the right to health and instill health consciousness among them.
It is also the policy of the state, consistent with the Constitution, to promote the general welfare of its people.
Can smoking be considered as beneficial? 1 Corinthians chapter 6 verse 12.
Can it be said that smoking is truly honoring God with your body? 1 Corinthians chapter 6 verse 20.
Can a person honestly smoke for the glory of God?
We believe that the answer to these 3 questions is a resounding no.
So we believe that smoking is a sin and therefore it should not be practiced by Jesus Christ followers.
Go.
Smoking is no less forgivable than any other sin, whether a person becoming a Christian or a Christian confessing his or her sin to God, according to 1 John chapter 1, verse 9. At the same time, we firmly believe that smoking is a sin and should be forsaken, and with the help of God, be overcome.
Does it cause a person to lose salvation?
Go!
Center of Environmental Concerns.
Mental Center of the Philippines Foundation.
Earth Savers Movement.
Environmental Broadcast Circle.
Health Action Information Network.
Alliance.
Forum Philippines.
Health Justice Philippines.
Ate, mabili ko isang dala.
Ano pa?
Kasi advisable kapag nag-charge ka. May possibility na masira yung dala. Tignan mo yung single bad charger mo. 100.
So refreshing.
Parang nakakapaan. Kailangan gano'n. Kasi yung parang kahit yung juice mo.
Sarap ng yosi. Nakakatulong sa pag-move.
Lobat ka na.
Kailangan ka lang.
Sa laki pa sa kanya. Pre, alam mo ba dahil sa'yo namatay si Jason?
Sorry bro.
Ano magagawa na sorry mo? Patay na yung tao. Siya may kasalanan habang pag nag-yosi ako sumasama siya. Ano siya may kasalanan? Ikaw may karapatang paalisin siya. Ikaw yung nag-yosi. Pinapaalis ko siya eh. Mahal niya ako eh. Anong mahal ka? Anong po nagdikit sa pag-yosi mo? Dikit siya ng dikit. Yakap siya ng yakap. Pag nasisingot niya yung mga usok na nanggagaya sa yosi mo, sobrang nakakapekto sa kalusugan niya. Sorry, bigla siya namatay. Sorry, tingnan ko to. Ito oh. Hindi ko na makakalain niya. Ito nakakainan ka nito. Nasisingot niya pa araw-araw. Ano sorry? Ano sorry? Ano sorry? Bakit? Ba't ano magsusundo ka na lang tayo?
Go!
Ano gagawin na sorry mo? Mag-aaway pa ba tayo? Ano ba magagawa? Hindi na makita siya. Kailangan magagawa sorry mo. Ba't tulak ka na tulak ha? Bro, patay ka siya. Oo, patay na nga. At ikaw may kasalanan nun. Bro, wag na natin magawain kasi tapos na. Ano wag pag-alayan? Ano gusto mo mangyari ha? Tak!
Isang piraso lang.
Cut mo na yun.
Go! Oh, pre, nag-yosi ka na naman. Ay,
Ulit na nagbago na ako.
O, kaya app mo pupuno.
Go!
Cut.
nagulat ako sa'yo. Kala ko yosi ulit yan.
Di bro, nagbago na ako. Salamat sa lahat ng ano mo, pre.
Sabi ko naman sa'yo, walang matutulong maganda sa'yo pag yosi.
Bro, salamat bro. Ngayon, after itong ex ko, si Bianchi, magbabago na talaga ako. Steak ko na lang inakain.
Bro, puro magandang bagay ang matutulong sa'yo kapag tinigil mo na ang pag-yosi.
Salamat bro.
Walang anuman bro.
Maganda yung sundukan ha.
Di na talaga bro.
Salamat.
Salamat.
Good evening. We're here tonight to discuss the diseases in the respiratory system. The first question is, can you please explain what asthma is?
Okay. Asthma is actually a respiratory disorder. It's a chronic disorder. When you say chronic, it means it's occurring for a long time or it's constantly recurring. Ibig sabihin, nangyayari siya paulit-ulit. Asthma is basically an inflammation. Ang nag-inflame, ibig sabihin, namamagay yung mga airways natin. It's chronic inflammation of the airways, the bronchis, and this causes obstruction. Also, added to that is the increase in the mucus secretion. So when that happens, the patient experiences difficulty of breathing, chest tightness, shortness of breath or hinihingal, and coughing. And of course, one of the best signs kung paano natin masasabing may asthma yung patient is the presence of wheezing. Wheezing is a sound produced dahil masisikip na yung mga airways ng patient. So when you auscultate or when you use a stethoscope to listen to the patient, or even if you're not using a stethoscope, maririnig mo, may marinig ka sound na gano'n. So that's one of the things na masasabi mo talaga may asthma yung patient. And asthma is actually caused by different factors. You can say it's caused by genetics or other environmental factors. When you say environmental factors, pwedeng may exercise, pwedeng because of allergens, or pwedeng non-allergen na things like smoke, medications. Their medications also cause asthma, and changes in weather. Sobrang lamig, sobrang init. Also, pag sinabi mo namang exercise-induced asthma, I think most of the patients na may asthma ito na-experience, no? When they do strenuous work or strenuous workout, exercise sila, hinihingal, doon uma-attack yung asthma nila. And isa pang cause is allergies. If you're allergic to pollen, if you're allergic to dust, or animal dander, o yung natuyuan na laway ng pet, or yung particle ng skin ng pet, so pwede rin mag-cause yun ng asthma.
Second question.
Okay. Stop.
Second question is, what is tuberculosis?
Okay. Tuberculosis is a disease that usually affects the lungs. Said usually kasi pwede rin siya maka-affect sa other parts of the body. However, yung lungs yung pinaka-main target niya. It is caused by a bacteria called Mycobacterium tuberculosis, and it's actually caused by, it's actually a droplet infection. Ibig sabihin, pwede siyang maipasa by coughing, sneezing, sometimes even talking to a person with tuberculosis.
How will you know if a patient has TB?
Okay, there are actually two tests, no? May two types of tests. Kasi meron tayong tinatawag na latent tuberculosis, meaning hindi labas yung symptoms mo, and active tuberculosis. So, for active tuberculosis, you have to do chest x-ray and sputum examination. Kapag naman latent TB or infected lang ng TB pero walang signs and symptoms, skin test na. Now, the signs and symptoms that I was talking about would include, of course, coughing. If you're coughing for more than 3 weeks, or 3 weeks or more than 3 weeks, yun, there's a chance na meron kang tuberculosis. Chest pain, or you have difficulty of breathing. There's also some pain when you're breathing or coughing. Weight loss,